discovered that there's a big body of research on ivermectin in use of cancer. But I've also got patients now who are taking ivermectin, who have Parkinson's disease, and now they're playing golf, and they were barely mobile, a month or two ago. And after a month of taking ivermectin, they're playing golf. They're getting their mobility back. And this is like, and they're taking all of the top of the line Parkinson's medications that weren't able to help them for years. And yet now they're seeing improvements that they haven't had in many years in ivermectin. Same thing with Lyme disease. Patients who've been suffering, with Lyme disease for decades, having, complete relief of joint pains, rheumatoid arthritis, acne, eczema. So a lot of inflammatory conditions, a lot of chronic inflammatory conditions. I had a patient with severe fibromyalgia, bedridden on eight pills of tramadol, just on maximum amounts of painkillers. Her life completely destroyed. She started taking ivermectin. By day 5, she was crying. She couldn't believe the relief she was getting with her severe fibromyalgia. She wrote to me. I put that story out on my Substack. So it is an incredible drug.
So what
It has
kind of
many applications, and not just cancer, but also anti-inflammatory and some of the autoimmune and even neurological diseases as well.
what kind of dosage would a person like that use?
For Parkinson's disease, for I can tell you, for inflammatory conditions, uh, I usually recommend 24 milligrams, which is two 12 milligram pills. Start with that,
A day?
try that for a few weeks, a day. Yeah, once a day.
Right.
And that seems to address a lot of inflammatory conditions. For neurological conditions, you start to go a little bit higher, maybe 36 milligrams a day. And so I had actually my Parkinson's patients started seeing significant improvement at a dose like that, 30, 35 milligrams a day. Then I did increase the dose to about 50, 60 milligrams a day, and that's when they started seeing, really dramatic improvements. And so, there's a little bit of trial and error involved in the dosing. And of course, once you go over 50 milligrams, then you start getting into the cancer dosing. And, depending on how much cancer you have, how aggressive it is, and so on, that dose can vary. But an incredible drug. And not just taking it orally, but it has also amazing topical applications as well. So when you good old horse paste from Tractor Supply, people just start putting it on their skin, right? They start putting it on things and trying things. And then I get flooded with all these testimonials of people's skin cancers disappearing. They start putting it on basal cell carcinomas or squamous cell or even melanomas, and they see these lesions shrinking right before their eyes. And again, there's no research published on this, and yet people are trying it. They're seeing the results, and if after a few months of applying it topically, the skin cancer literally falls off. It falls off. It's gone. And people are treating all kinds of skin conditions. Severe acne. I've had some patients with this cystic acne, which is the worst type of acne you can have, seeing relief for the first time, and they've tried every medication there is out there. The dermatologist, prescribed them every medication. They've had no relief. They try ivermectin. They're seeing relief for the first time. So you can apply it
Wow.
topically as well. Some really incredible stories coming out. People with nodules, lipomas or lesions. I have breast cancer patients that have, for example, axillary lymph nodes. They're putting topical ivermectin on, and they can feel the cancer